Now for those of you who have a crooked squat, I'm going to take you through this assessment process as well as some ways that we can even the squat out. Again, if you're unsure, the reason why this is actually important is because if you consider that engine analogy we've been talking about, we're trying to build an engine that if you only have one cylinder working, you might as well have the other one working as well if you had a two-cylinder engine. So going through this assessment process, I'll take you through a couple different ways that you can look at it or have a friend look at it, and then how you can implement the correct strategies to then have a normal symmetrical squat to build the engine in a better way. Now when we look at squatting, it's important then to realize again which way we're sliding towards. So it's nice to have a stick, some type of reference point, especially if you're an untrained eye. This stick just happens to be crooked. But I have people squat down and just see, does their zippers line up with this or not? And in first assessment, I don't have people really think about too much. Go hands behind the head, squat down as far as you feel comfortable, and then check and see, is my zipper lined up there? I look like I am right now. Now if I can't tell, another way is you can use feel of the feet. So if I'm squatting down and I start to go like this, I start to notice that I have more foot pressure on this, my knee feels like it's triggering and it's doing a lot of work on my quad here. This side feels fine. So that's one way you can assess based upon feel. Now, another way is if you look at your foot. If you see your foot kind of moving, this one's going to have more load onto it. This one's going to be more free to move. So if you can't move this one and you can move that one, you're probably shying away from this side. Another thing to consider too is that if you can't leave your heels on the ground, you're not going to get a proper assessment. So it doesn't matter how deep you squat, just squat as deep as you can as long as the heel's on the ground. And just pause there. This won't work for this assessment process. Now if you're wondering what's happening here is that because we've had a past injury on a certain side, the brain still thinks that loading and putting weight onto the side is going to create pain. Now we call this an alarm system. There can be a true alarm or a false one. If there is no injury over here anymore, and this was been like 5 years ago, this is probably a false alarm. So all we have to do is just build that trust within the brain again to bring this thing back. And surprisingly, this doesn't happen with everybody because everybody's very different, is a lot of times that when they slide off this side feels pain-free. It's usually more flexible. The hip moves a lot more. And this side is the side where you tend to get plantar fasciitis, you tend to get sciatica, back pain, chondromalacia patella, hip issues. This side's doing a ton of work. All we have to do is spread the load out. So again, if we're using that engine analogy, we're getting both sides of the engine to start working, then to do the proper movement or movement. Now the process I like to take to re-even this thing out is first I like to use an exercise called the diagonal sit. And that is going to be included in this course. It is one that is a lot of times hard for people to get. But notice the cues that I'm using in it. They're specifically like this for a reason. I'm not just making jokes in it, I'm doing it so you can actually feel what you're supposed to feel. We're using the ground in that case to load the hip. In this case, we're talking about this one. We're using the ground to load the hip to build the trust that the brain can use it again. The second one is we start to bring the foot on the ground, which is the frozen skater. That one then tells the brain that is again okay when you're standing, because when you have a lot of rehab and PT done, and you're all on the ground, you really never teach your brain to use your foot when it's in contact with the ground because honestly the mechanics change a little bit. So take that process first. Diagonal sit, do this side, frozen skater, this is the stance leg, and then I like to use mini bands. A little mini band walking side to side tends to do a lot of good, but because that one's not as specific, a lot of times people don't recognize or people don't tend to respond well doing that one first. So I like to load the side, get the brain to realize, open chain, foot off ground, closed chain, foot on ground, and then do it side to side, spend a couple minutes, and then we're going to go into our squatting and hinging patterns. Now if you're wondering how many times you should be doing this or when you should be doing it, I oftentimes like to have people do this as a warm-up first before they actually build into those compound movements such as squatting and hinging. The reason being is because we got to get that second engine turned on before we can actually start to add some weights and load to it. So I like to have people before you're going to do a squat and a deadlift and a push and a pull and a carry, do this first. This is part of the warm-up. This is part of just getting that thing to start working. Now if you're wondering, can you do this on off days? Sure you can. There's nothing wrong with building this better habit. And we consider this kind of like a bank account effect as well as some of the torso stiffness exercises. A lot of people don't get this way on accident. They've had a past injury on that side, they've had a past knee injury, a foot injury, a hip one that they slide away from. Now, the more you do this, you build a good amount of a bank account. Think of it as an upward climb, good rep, good rep, good rep, and then you can take a little bit of a dump or a mistake. So build the account before you take a withdrawal. Now, are there other exercises that can work for this to even the squat out or the hinge out? Yeah, there are. I just tend to use these ones in this order because it's worked well in clinical practice. It's worked with people that I've worked with one-on-one. Now, obviously, people can do them poorly, which then won't end up evening the squat out. So the good thing is we use this test-retest model. You should even out. If you don't, then you didn't do the right stimulus the right way or to the right amount of time. So consider that. And if you're having problems or pain with this or an increase in symptoms, you're probably losing torso stiffness and you're probably doing it poorly. So always get checked out by a medical provider or a rehab professional.